Hello everyone, it's my pleasure to present my research on the topic entitled Development of an Innovative Albumin-based depot formulation for controlled release of amphotericin B. Nowadays, fungal infection has emerged as a major global health concern. Around 6 billion of people are getting affected by it, and around 3.8 billion of people are facing death. Amphotericin B is a widely used antifungal agent. Amphotericin B is a polyene antibiotic containing a 38 membrane macrolactone ring. One side of the lactone ring contains 7 hydrophilic group, making it hydrophilic, and other side contains 7 diene conjugated bond, making it hydrophobic. Since amphotericin B contains both hydrophilic chain and hydrophobic chain, it is bipolar or amphoteric or amphiphilic in nature. Amphotericin B, when exposed to the aqueous environment, it start to form aggregation if its concentration goes beyond 1 microgram per ml, which is the threshold concentration of amphotericin B. When amphotericin B forms aggregation because of this formation of hydrogen bond between this hydrophilic group and surrounding aqueous environment. Amphotericin B exists in 3 different forms like monomer, oligomer, and polyaggregate. Monomer self-aggregate to oligomer, which on self-aggregation forms polyaggregate. Out of these 3 forms, oligomeric form is highly toxic. Amphotericin B, when interact with the mammalian cell membrane, it binds with the cholesterol and forms hydrophilic core. This due to this intracellular leakage of iron uh, occurs. Also, loss of cytoplasmic content and eventually cellular death occurs. So, when we use amphotericin B as an antifungal agent, hemolysis, nephrotoxicity, and cardiotoxicity is major limitation. So, to mitigate this amphotericin B induced toxicity, control release of amphotericin B by maintaining drug concentration below its critical aggregation threshold value can be a promising strategy. So we have developed a strategy by formulating a amphotericin B loaded depot formulation. Our strategy has two novelty. One is from formulation point of view, and another from its technology point of view. From formulation point of view, we have developed amphotericin B nano formulation by adding cholesterol into it. Addition of cholesterol while preparing amphotericin B nano formulation will be helpful to keep the amphotericin B in monomeric state by interacting with it, which will ultimately prevent interaction of amphotericin B with membrane cholesterol and will contribute in reducing the toxicity. After development of the nano formulation, we have dispersed it into the albumin solution, and to this albumin solution we have added the ethanol, and by mixing both these phases we have developed the amphotericin B nanoparticle loaded albumin depot formulation. This depot formulation will enable amphotericin B concentration below its critical aggregation concentration, which will prevent the formation of toxic aggregate state and will enhance the safety. Our aim is to develop amphotericin B depot formulation with decreased toxicity, easy scalability, and affordability. The objective is to develop albumin-based amphotericin B depot formulation and to evaluate the formulation for the aggregation state of amphotericin B nanoparticles, cytotoxicity, and hemolysis in vitro drug release from the albumin depot. Coming to the methodology, we have prepared the amphotericin B polymer nanoparticle by a nanoprecipitation method as shown in this schematic view. After the development of the nanoformulation, we have characterized into parameters like particle size, PDI, zeta potential, entrainment efficiency, drug loading. Out of this formulation, F2 is our optimized formulation with particle size of 123 nanometer, PDI of 1.16, and zeta potential of minus 26 millivolt, entrainment efficiency of 61%, and with drug loading of 11%. Same image of the formulation has shown the particles are spherical in nature with smooth surface. We have conducted the hemolysis study of amphotericin B, a free drug, and its nanoformulation. Cholesterol and its nanoformulation has shown less hemolysis compared to other two. The reduced hemolysis with a cholesterol enriched amphotericin B nanoformulation could be due to the controlled drug release from the polymer matrix and prior interaction of the amphotericin B with the added cholesterol in the formulation, which has limited the availability of free amphotericin B for direct interaction with the erythrocyte. Then we have conducted the cytotoxicity study in HEK 293 T cell line and raw cell line. In this study, we have found that the amphotericin nanoparticle enriched with cholesterol is more cytocompatible. The higher cytocompatibility of the cholesterol enriched amphotericin B nanoformulation could be due to the altered interaction of amphotericin B with mammalian cholesterol membrane, as incorporated cholesterol might have compete with mammalian cholesterol for amphotericin B binding site and has caused less cytotoxicity. Then we have developed amphotericin B nanoparticle loaded albumin depot formulation by taking albumin, water, and ethanol as formulation component. By varying the concentration of this component, we have developed the depot formulation and have reported the gelling time. We have considered 2 minutes as optimum gelling time for the development of our depot formulation. Out of this 14 trial, F14 is our optimized formulation. Then we have plotted the ternary phase diagram to, from this ternary phase diagram, we have found that albumin of 20% and ethanol water each of 40% is our optimized composition for developing the depot formulation. Then we have performed the in vitro release profile of the depot formulation and have compared with it the nanoparticle formulation. Here we found that nanoparticle formulation from nanoparticle formulation 96% of drug has released within the 6 hours. However, the depot formulation have shown sustained drug release and around 60% of drug has released within at the end of the 7 day. From this study, it is clearly revealed that the sustained release from the depot formulation would be due to the slow enzymatic breakdown of the albumin matrix. So these are some references of my research work. Thank you.